But I want to thank everybody. I'm really quite touched and honored. I do want to, actually though, I don't agree with two things that Alberto said. And I don't often disagree with Alberto because I've worked with him for many, many years and he's taught me a lot. But he said two things that I got to correct the record. First, he said that I had no reason to do what I did. And actually, I had about 10, 20, 30,000 reasons to do it. And they're the 10, 20, 30,000 people, women, who couldn't get prenatal care. So there were a lot of reasons to do this. And you'll forgive me, Alberto, if I take offense at what you said, but because we're friends, I know I can do this. And, you know, the other thing that he said is that it was because of what I did. And it really wasn't anything that I did. It was what a whole lot of people did. I didn't do a whole lot. I listened and I helped out as I could. But there were many people who have been involved in this, many people who are here tonight, and the credit is not mine. Like any good thing, it only happens when all of us work together. And so this is really something that's, it's a community achievement, but it's actually kind of bittersweet. And it's bittersweet for a couple of reasons. As Alberto said, this is only in 6 counties. 5 counties, 6 counties. There's 36 counties in Oregon. This is something that needs to be everywhere. There shouldn't be a county in this state, there shouldn't be a hospital, there shouldn't be any place where women can't get the prenatal care that they need. So this is just the beginning of moving towards where this is not the exception but the rule here in Oregon. And quite frankly, no offense to all the women in the room, but this shouldn't be just for women. Everybody should get the health care that they need. This shouldn't be simply about prenatal care. This should be about living in a state where everybody can get the health care that they need. And we shouldn't rest until that happens. You know, health care is such an extremely important thing in all of our lives. If you don't have your health, you really don't have much, and it's important that we all get the health care that we need, and it's really, I think it stains us as a state, and it stains us as a nation, that we have such a wonderful healthcare system, we have such great advances, we have things that can help cure kids, and help moms, and help dads, and help everybody, but yet not everybody can get that care. And rather than having all these wonderful things narrow the gap between us, unfortunately sometimes it really widens the gap between those of us who are fortunate enough and those of us who aren't. So tonight was really just the beginning, I hope, and maybe we'll do this again in a year or two when everybody in this state can get the health care that they need, and I hope everybody will join me as we continue to fight for being certain that everybody in this state, no matter who you are, no matter where you were born, no matter what your name is, no matter whether you're rich, poor, black, white, short, tall, whoever you are, that we can all get the health care that we need and that we can all be healthy. You've got my commitment to work towards that.